While many hospitals in our region are now mandating the vaccine, the only state in the nation to require all healthcare workers to get the vaccine, that's been New York. But today, a judge put a stop to that, siding with a group of nurses from an Albany area hospital who said forcing them to take the vaccine violated their civil rights. Now, with this as a backdrop, groups opposed to mandatory vaccinations, they staged a protest in Wayne, New Jersey, just outside the building where the second gubernatorial debate is being held as we speak. Now, our mobile journalist Regina Orsani was there, and she joins us now live from the scene thanks to our new live streaming video. Regina?
Well, Rich, the debate here tonight is not just about the candidates. It's about a bigger issue that's affecting parents and healthcare workers alike. Mandated vaccines, and many people we spoke to today are concerned that it should be their choice, not the state's.
Show me the science! Show me the science!
Doctors, nurses, and parents rallied outside the New Jersey gubernatorial debate, protesting for their right to opt out of getting the H1N1 or seasonal flu vaccine.
I really believe that mandating shots and telling parents what they can put into their child with no choice is ridiculous.
I think that they can tell us we recommend that you get these shots. I think they can say, here's what our science says. Here's why we think it's a good idea. However, at the end of the day, nobody can tell you what to put in your bodies.
Last year, New Jersey mandated that any child attending daycare or preschool get the flu shot or get kicked out of class. This year, for the first time, hospitals, universal healthcare systems, and even the state of New York had required that healthcare workers get it too. Not all are happy about it.
And I have a right not to take this vaccine. You have no right to impose this on me, especially since you have no evidence that it works.
The mandate in New York required that all healthcare workers who have contact with patients get the flu shot by November 30th or face the possibility of a hefty fine or even losing their job.
Healthcare workers take care of people who are ill. Very straightforward. And when you take care of people who are ill on a day-to-day basis, those are the people that are at risk.
According to the New York State Health Department, voluntary vaccine rates for healthcare workers average around 50%. A big reason why the state and some physicians like Dr. George DeFernando say it needs to be enforced.
I think most healthcare workers would say, well, yeah, I should. But here are the reasons why I don't. Either I'm not going to get vaccinated, or I don't want to be mandated to be vaccinated.
Dr. DeFernando says the reward far outweighs the risk when it comes to the flu vaccine and believes many other states will soon follow suit. But opponents say much more research has to be done before the state can force a shot upon anyone.
I'm totally against it. I don't think you could mandate anything, any medical procedure that has a risk of death or disability.
Now, after the judge's ruling today, enforcement of these mandates is still lingering. And questions remain whether or not these hospitals and these healthcare centers are actually going to continue to push these workers to get the shot. Rich?
Regina, are these protesters more worried about possibly getting sick, or are they more mad that somebody's telling them they have to do it?
I don't think they're worried about getting sick. I mean, they do have some precautions. They're just really mad that people are forcing them to do it. They feel like the state has to come out with more statistics, more research before they force somebody to do it. So I think that angers them a lot.
Hey, Regina, thank you very much. Appreciate it. All right, the government. They've said over and over again that the swine flu vaccine has gone through all the safeguards as a regular flu shot has. But this new strain of flu, it has inspired a lot of fear and a lot of hype. As a result, New York's push to require all healthcare workers to be vaccinated, it ran up against a protest movement organized by several nurses from the Albany Medical Center. The group staged this rally at the state capitol last month, and after the judge's ruling today, their lawyer issued this statement. These are not libertarians. These are not lefties. They're not right-wing lunatics. They are healthcare professionals, and they think the vaccination is not going to be good for them. They've got no confidence that either the seasonal flu vaccine or H1N1 vaccine is good, or is going, I should say, to do any good for them, end quote. But the concerns of healthcare workers, it's become material for scare merchants like, of course, Glenn Beck.
Healthcare workers, because they can't be sick, they got to be in giving you a shot. Well, in Albany today, this is happening. Healthcare workers are protesting being forced into getting the shot. Well, why? If the government says it's okay, why would that happen? Who do we believe? The doctors and the nurses that say, well, you ain't giving it to me? Or the government that says everybody has to have it?
Again, fear the government. But just a quick look around the country shows that not many people seem to be listening to Beck's fear-mongering, or maybe even those medical professionals who say this is terrible. Long lines for that vaccine, like this one in Baltimore, they're far more common. And with demand so high, you got the converse issue where local officials are having problems keeping the vaccine in stock. And if healthcare workers in the Hudson Valley don't want to take the flu vaccine, there are plenty of people who it seems are going to be more than glad to take it. County officials from Westchester to Ulster reporting severe shortages of the vaccine, and in many places, flu vaccine clinics, they've been put on hold until more shipments arrive. Now, that raises this question. It's a question we put to you at home. Is it not the responsibility of those in the front lines of the disease, our doctors, our nurses, EMTs, to be the first in line for the vaccines? So, now I want your take at home. Should healthcare workers be required, not asked, but be required to get vaccinated if they're going to treat you or me when we walk through those hospital doors? 888-RNN-CHATS, our toll-free number. I'm going to get your phone calls and your emails at rnntv.com. All of that coming up after this quick commercial break.